Good evening. As you know, my name is Tara Bose, and I am here before you this evening as a dedicated nurse and healthcare leader with over 18 years experience working in the Alberta healthcare system. My journey in nursing has taken me through medicine, critical care, cardiac care, burn nursing, emergency, and surgical nursing. I've held roles ranging from nursing attendant, registered nurse, clinical nurse educator, and manager. I am currently responsible for overseeing an emergency department, an ambulatory care clinic, and a respiratory therapy department. I have been very fortunate to gain my experience in both of Alberta's largest healthcare providers, HS and Covenant Health, as well as rural and urban settings, seeing nursing from different positions, different employers, and different locations, not to mention working in direct collaboration with interdisciplinary teams, both in the front line and on different committees, has provided me with a very robust and diverse understanding of nursing and healthcare. In addition to my nursing and healthcare experience, I have cross-sectoral experience in the construction industry, which has provided me valuable exposure in areas like project management, risk management, creating a culture of safety, and team coordination. Currently, I sit as a board member on Access Bridgeworks, which is a small bridge building organization. And my role in the board is primarily focused on strategic oversight, which includes advising on long-term vision and direction and reviewing major decisions and monitoring key performance. So additionally, I hold an executive master's in health administration, which has provided me even further knowledge on governance, so future planning, finance, policy, and advocacy. My experience has allowed me to foster a large network across Alberta, Canada, and even down into the Western United States. It would be my honor to bring my experience and my network to the AN board. If I am elected to the AN board, I would like us to focus on three key strategic priorities. So the first being nursing workforce retention. We must develop and implement strategies to retain nurses at all experience levels. Alberta has a particularly high attrition rate, with 4 out of 10 nurses leaving the profession before they turn 35. The Chief Nursing Officer of Canada has developed a nurse retention toolkit, and I believe that the AAN should work to support the implementation of it across Alberta through awareness, empowerment, and advocacy. Another aspect of this is supporting new grads and ensuring they're set up for success. We can strengthen programs like the undergraduate nursing program and mentorship and raise awareness about external supports such as peer-to-peer group supports and specialized nursing associations. Retention is a complex priority, so leveraging predictive analytics can help us predict risk and advocate for systemic change to drive real and sustainable impact. The second priority is investment in nursing education and professional development. The AAN can play a key role in enhancing partnerships with post-secondary institutions to improve clinical placement by empowering and supporting frontline preceptors. Many nurses are hesitant to preceptor due to uncertainty or lack of support and increased workload. So we can change that through mentorship and recognition. Additionally, we can offer micro-credentials to support professional growth across the career span. We can explore innovative education tools such as virtual reality and AI-powered simulation to ensure that nurses, even in the most remote locations in Alberta, have access. Through partnership with specialized nursing associations, healthcare providers, healthcare systems, and system-level advocacy, we can expand the educational opportunities across the province. The third strategic priority is to strengthen public awareness and professional identity. So while nurses often appear in the media for union-related issues, the AAN has a unique opportunity to reshape the public narrative. Through collaboration with the unions and other nursing bodies, we can present a unified front that emphasizes how nurses are the core of the healthcare system and pivotal in system-level solutions. We can launch public education campaigns that highlight how nurses can enhance healthcare access, support chronic disease management, and reduce system strain. By submitting data-informed policy briefs, we can advocate for expanded scope of practices, safe staffing legislation, and investment in leadership. Additionally, I propose a speakers bureau, a group of trained nurses who are leaders and prepared to professionally represent us publicly. Through a media toolkit and expert voices, we can amplify our message to reinforce nursing's value in the public eye. In order to build a strong and inclusive association, I think we need to work on growing our membership so we have a better diverse representation across all the communities in Alberta and in all leadership roles. A broader membership base means a stronger voice to influence policy and drive meaningful change. Serving on the AN board would be a true privilege for me. I am eager to collaborate with fellow board members, nurses, and stakeholders to support our professional development and improve care across Alberta. Thank you.
Fantastic. Thanks, Tara. Terrific vision. And again, just excited to have people interested in joining the board, like such talented folks. My suggestion, and we didn't talk about this sort of in advance, but my suggestion is we have all three candidates have a chance to speak, and then we can ask questions. Is that fair for everyone? Okay, no one's going to say no. Kathy's saying yes. Next up, we have Doran. So Doran, you are here. Terrific. Thanks so much.
Hey everyone, I'm Doran Walker. I'm a RN who started out working in psych emerge in different mental health substance use places. I still hold a position there actually. Currently I'm in a leadership role for older adult rehabilitation at the Glenrose. I've worked in leadership up to Director of Mental Health Substance Uses within BC. I wear a few different hats. Two of the other areas is I do healthcare consulting, mostly with healthcare innovation startups off the side of my desk. And I've been very involved in the healthcare leadership space, incorporating a national organization called Emerging Health Leaders. And I'm the chair of the local CCHL, Northern Alberta chapter, or incoming chair in the next couple months here. But just refreshed all their professional development events. Some of the highlights of which are the Human Library event, which has featured the CEO and COO of Covenant Health, as well as a lot of executives across AHS and GOA. A series of CEO fireside chats that as all the new corporations are startup, their CEOs are going to speak at. Next one is Carrie Bales and Kim Simmons to follow. And in 2 days, which is very fresh in my mind, the first ever national Emerging Aspiring Leaders, Healthcare Leaders Conference, bringing together healthcare leaders from as far away as Nova Scotia to Vancouver Island. And proud to state that 3 of our local hospitals here has signed up as sponsors to simulcast the conference to all their leadership teams, the Royal Alexandra University of Alberta Hospital and the Glenrose Hospital. Hoping to expand that out to Calgary and the rest of Canada hospitals next year as well. What I hope to bring to the Alberta Association of Nurses is with retention. I recently authored a white paper called Healing Hospital Communities that received a recommendation from the Surgeon General of Canada, but is very specific nursing work in order to both improve psychological safety as well as staff wellness and engagement in a very practical way. It's been scaled from Ottawa to there's some in VHA as well as we're kind of working our way up through AHS right now, but has had really tangible results. In the news recently, we've seen the kind of both the rates as Tara, was it Tara right before I was talking about nurses dropping out by 35 years old in Alberta, and as well as our Gallup polls across AHS here being moving backwards as we go over the past few years. But areas that were within this study moved forward, some of them from the second worst quintile to the first quintile for staff engagement in the Gallup polls. As well, I would really like to focus on value proposition for the AAN through some of these professional development events, connecting in with some of the professional development events that we've already done, but building new ones out for the organization. I'm someone who's very busy and is very much if you want someone who's about change and growth, then that's the person that I am, and would really like to be able to contribute to both the profession that's given so much to me, as well as you know, through work on this board. So thank you so much for the opportunity.
Thank you so much. Terrific, Doran. Great to meet you and hear from you. And last up, we have Tammy. Where's Tammy? Tammy's here.
There we go.
Oh, terrific. Hi, Tammy, over to you.
Yes, thank you. Yeah, good day. I'm Tammy Beduza. I currently work in palliative oncology at the Red Deer Regional Hospital. I'm honored to present my candidacy for the AAN Board of Directors. My platform basically centers on quality of life and quality of care, with a commitment to making a difference in every professional interaction. Some of my nursing background and experiences across multiple settings in Alberta and Saskatchewan, acute care like neurosciences, palliative care and oncology, community, home care, rural and urban settings. I worked in specialized care such as persons with disabilities, complex and also including mental health and behavioral supports. Some of my leadership has been in team lead experiences in ALC alternate level of care and long-term care organizations and other supervisor and program coordinator roles in my previous experiences, even prior to nursing. Some of my administration is through some of the same organizations and some of my other being on different boards, like budgeting, policy development, and procedure and implementation in a few different areas. Some of my key skills is relationship building, networking with stakeholders, families, patients, and interdisciplinary teams. Strategic thinking. I think I'm a visionary. I like balanced, informed decision making with innovative approaches. I very much like being involved in my community, both employment, recreational, and local communities. Some of my leadership has had some formal training with interest in expanding more regulatory knowledge, such as AAN. Some of my priorities for AAN strategic direction would be workforce sustainability, such as addressing critical nursing shortages through targeted recruitment and retention strategies, nurse well-being, tackling workload issues, burnout, mental health concerns, some of the workplace safety, including physical safety and psychological security and safety, and the team dynamics within where you work. Healthcare access, ensuring adequate nursing coverage in rural and remote areas. Professional development, providing ongoing learning opportunities, especially for new employees, and those that are maybe older employees that just want to continue their education. My approach to creating an environment where all nursing designations feel valued, inclusive representation and filling gaps, ensuring governance includes all nursing designations. Let's see, recognizing programs and progress, celebrating. I think it's all important to celebrate any type of excellence across all nursing roles. Any little things is important to celebrate. Mentoring nurses, including new nurses and new nurses to their role. Let's see, having a unified voice, presenting cohesive advocacy while acknowledging unique contributions and strengths of peoples and nurses. Even today, like after a personal regular checkup with my family physician, I was able to provide valuable resources that could help improve patient care while enhancing our interprofessional relationship. It was just my family physician, but he asked me today, hey, where I was working, and we both agreed that healthcare navigation can be challenging, even for nurses, for physicians, for patients. So sharing knowledge about available resources and services can make a difference in everyone's life. He reported that a patient was required to wait in the ER for 10 hours after adverse effects after chemotherapy. And so I just provided 3 resources for a reference, like the main palliative physician at Red Deer Hospital, community care access information, specifically home care and palliative specialty referral, and I gave the form that he could refer to or send his patient to, and also the community paramedics services and their form, that is available for people to help people keep comfortable at home rather than having to go to the ER and spend hours at that ER when they're already uncomfortable. In closing, I bring both insider and outsider perspectives to nursing, which I believe strengthens my ability to represent Alberta's nurses effectively. I'm committed to being the right person at the table to advocate for our profession, and I very much thank you for your consideration.
Fantastic. Thanks, Tammy. Again, really terrific to meet you as well. Okay, so that's the three of them. We did have a fourth candidate who had to withdraw due to her conflicting time commitments, which is, again, very common in the life of most nurses. So I think we do have some time for, 7:24. We have some time for, do people have questions for our candidates? Like my suggestion is if there's someone has a question, all three individuals answer what they would think, and we can, maybe I'll switch up the order. So anybody have a question they'd like to ask the candidates? Okay, first off, I'm Kathy. I'm going to skip you. I'm going to go to Nicole.
Sorry, Kathy. Tara, you had mentioned that as part of the professionalism pillar for the AAN about expanding the membership, and the question will be to all three, but maybe since you mentioned it, you've thought a little bit about a strategy, or how will you would you plan to increase the membership of AAN?
Yeah, that's a good question. So I think that the AN is so new in the fact that it has just so recently been separated from CARNA, or from the CRNA now. And I think that getting the voice out to general nurses of what we do, and what the AAN is there for, to help them, how we help them, really getting that message out on platforms like social media, even if it's feasible, having members of the AAN board and employees of the AAN go to different locations and show that advocacy and talk with the nurses. And if we set up in a public location, we'd be able to even talk to the public, so we could spread through word of mouth, because I think a lot of nurses just don't quite know what their money to the membership is going to get them and why it's important that they are members. So that's how I see, and the more that we're out there and the more that we're able to show what we're doing, hopefully that would entice more and more members. And then at the same time, kind of showing that it's not just the once a year when you renew your CRNA that you can become a member. You can become a member at any time that you're interested.
Terrific, thanks. I'm going to jump to Doran. How would you increase membership? What would you ideas you would have for increasing AAN membership?
Yeah, I'd probably develop a very specific marketing plan. Just looking at the AAN, even on LinkedIn, it's got about 2K followers, but with there's a few different methods using kind of LinkedIn Navigator and that we can start growing that. And then with a series of events throughout the year, if that's kind of planned, then we can develop a very robust value proposition along with the webinars and kind of all the different educational tools that they already have. And not to reiterate, but just to get like a very clear message about what the AN is all about out to everyone. And then with these different events throughout the year, start to generate some excitement about the whole organization, and really to attract people by kind of what we're offering and different things, generate some excitement about it. Also, I'd like to connect in probably more with the universities, really connect in with the Alumni Council. And it'd be nice to kind of generate more excitement just as people are coming out, of their bachelor's, but as well, when they're going into more of their senior work, bring them in, tie them in as volunteers as well to kind of keep moving everything forward.
Thanks. And Tammy, over to you.
Well, I'm pretty new to AAN and pretty new to Alberta in that respect. I know it's a huge discipline like AAN. I mean, there's so many areas to reach with, and being part of societies or associations is so difficult to get membership. Being in different boards and stuff like that, it's so hard to make to have people feel excited about being part of an association and how they can make a difference. And some of it is working together again um, um, with the other disciplines in regards to Karna and to the LPNs. They're sorry, I don't know the LPNs. Their main Karna type thing, and even being able to work together with those colleges and promote them, especially as nurses are coming out of school, and graduate nurses and stuff are coming out of school, and making that education enhanced in the school system, so that they're more aware, and that we're advocating for AAN to become part of the association, just as soon as they're coming out of school, and understanding that when they're going to school, to that information, and then being that tool and that resource in all the areas that you're working in, also your day-to-day activities with all your nurses that you're communicating with on a daily basis. And some of that is important, and of course using all the new technologies, or the computer technologies and resources, and is always important too, like LinkedIn and some of those resources that are available. Sometimes it's fun to do some of those new little clip things where people like to swipe really quickly, so it's like if you can find some tool or some resource or some visual thing that is captivating, to bring the attention, the light of and some cool, like technology thing that brings alive AAN and what it means.
Yeah, fun. Thank you, Tammy. Thanks. Okay, we'll start with, so don't go too far, because we'll start with you for the next question. Over to Kathy Howe.
Thanks, Barb. I wanted to ask this question because all of your RNs, and you're fine to be the RN board director, or one of the two. One of the things I've heard from in my role a lot from RNs is about scope of practice, and how can RNs have a bigger scope of practice and make the scope of practice bigger, work to their full scope of practice. There's lots of talk about, prescribing medications and that kind of thing. So, I mean, it seems really important to RNs that this occurs, to sort of value their role. I think sometimes they feel like LPNs are sort of starting to tread a little bit in their space, and they want their own scope of practice and identity. So how would you as a board director, support AAN, or guide AAN, or lead, or suggest that they start to engage, RNs to feel this way?
Tammy, I'm going to turn that over to you.
I know that's difficult, because I am seeing the gap closing in, and even HCA is coming into LPN and being able to do some of their scopes, and then the LPNs becoming, and being able to do more scopes that the RNs were able to do. I mean, I believe that it's still a big thing in regards to education, and it's that education, that experience, and that schooling is still very much important, because the nurses do have that little bit more of the managerial and the assessment skills that are a little bit more tweaked, more than the LPNs coming out of school. But I think being able to still be, the RNs are still able to be part of that health teaching and counseling, and assessing those health concerns, and being able to be that leader in that area. Yeah. I think we still have there's still a little bit of that gap with the RNs being able to communicate a little bit more effectively with all the interprofessional teams, to build that network and to build that team of all the interprofessional teams, and that still is very much part of the RN scope.
Yeah, thank you. I'm going to go to Doran. Thank you.
Thank you. Yeah, I mean, the first part about it, moving up into prescribing, I think that the more kind of information that we can put out about that and create comfort, then RNs can move into that space. The other way to kind of move forward is still with comfort as well. I find, there's more of the leadership training, but then sometimes there's not as much of a comfort level working to that full scope within RNs. So having more more kind of programs and training around leadership kind of lends directly, I think, into kind of other areas that I've worked in. But there's a lot of growth that can happen there that's almost kind of infinite into the healthcare systems. So developing kind of opportunities to move in those directions, I think will push it farther, and keeping to explore different ways to expand scope, because I mean, prescribing is kind of limited right now, but I think as time goes on, we can kind of increase that too, to make the scope bigger as well.
Yeah, thanks, Darren. And Tara, over to you.
All right. Yeah, I think you bring up a good point, and we have constantly seen, sorry, my dog is in the way, ever since 2020, when the LPN scope of practice expanded, where they could now take care of chest tubes, hang blood, administer blood. I think that that was a good kind of look into how much work actually goes into expanding scope of practice. Where we have to make sure that all of the training is done and it's retroactive. When will that training meet with the universities, the people graduating? When will they become just trained to the base level if we're increasing that kind of skill for registered nurses? So it's a lot of work and a lot of thought and coordination that would have to happen with the CRNA. And because the RN scope of practice would encroach onto physician scope of practice, we would have to look at communicating with the Alberta Medical Association and what that would look like. How does that actually look when you're rolling it out? What kind of liabilities would there be if we were giving prescription medications? Would it be for only Schedule 3, like over-the-counter meds, or would it be more? Currently, we know that nurses up north have a much larger scope of practice. They go through a lot more training, and it's due to need and necessity. So I think we would have to be able to show, especially to our physician colleagues, that that need and necessity exists in urban and rural centers where physicians are immediately available. So I think it would be a lot of coordination, and while nurses have the appetite for it, I think that we would also need to make sure that through working groups and communication with them, they understand that that increased role also means increased workload, which we always hear a lot of nurses saying that the workload is very high and it's leading to burnout. So I think those would all be factors that we'd have to look at.
Yeah, thanks. Interesting. Okay, thank you. Sarah has a question. Over to Sarah. And Doran, you're first, so listen carefully.
Hi. Sorry, I choked on a piece of fudge, so my voice is a little hoarse. But I was just wondering, how would you go about making LPNs feel respected and valued in the association?
Yeah, that's a very good question. I think that working kind of on collaborative ways of practice, a lot of when I first jumped into leadership, it was with, which kind of has a bad word sometimes, but COACT, but I took a lot of the kind of spirit of that, which at its heart was collaboration between all the between all the disciplines. I think that if we envision, hospitals and units and programs as communities, and that we're all parts of it, and really try to kind of understand each other through kind of understanding scopes and that, and rather than worrying about if one scope's increasing or not increasing, but work together on focusing on patients and families, that at the end of the day we all work together, and I see that every day already. I don't think I've ever worked where there wasn't interdisciplinary teams between nurses, and 99% of the time they're getting along. And even though there might be a bigger conversation about scopes and that sort of thing, I think at every day everyone's collaborating already. But highlighting that and moving forward and envisioning the whole system as communities, because we spend a third of our life at work, and that's a third of our life with all these other people in different disciplines. And it's important that we feel that that's our community as well.
Terrific, thank you. Tara, let's go to you next.
Right. Yeah, I think that it's really important in everywhere that we're working and as part of the board and the AAN, that we show that LPNs contribute equal amounts. We all bring different skills, we all bring different perspectives, and that all of those perspectives and skills have to be viewed as equal. I think that it's important to show that LPNs make up a very large part of our workforce as nurses, and LPNs are becoming more and more prominent in the ratio of RNs to LPNs. So making sure that and encouraging nursing leaders at the front line and throughout healthcare to have an equal representation of LPNs on their committees and their working groups so that they're able to bring that voice forward for the LPN and kind of like what Doran said, to recognize their contributions and promote what they are adding to our healthcare system, much like any other team member that we have on our interdisciplinary teams.
Thank you. And Tammy.
I I think respecting dignity goes across all the levels in regards to, like, even if I am a new RN going into a new unit or a new role, there may be LPNs that actually have more experience than a new RN in that on that position or in that role or on that unit or whatever. And learning from them is just equally as important. Some of the skills and the theory and some of the information the RA might have within, have acquired through their school and other education, but we're learning from each other, and some of those roles and stuff will definitely have to be adjusted and applied um, uh, based on whether you are the RN or LPN. But I mean, those will have to be eventually established and kind of regulated in a sense if more of the boundaries are being crossed, and that might take a bit. But I mean, even in regards to some of the RNs being able to prescribe, I mean, there might be some, maybe not prescribing medications, but being able to order maybe exams or some of those x-rays and some of those things that you're seeing, you're based on your assessment, some of those other things that maybe not require an actual prescription or order in that respect, but some of those things that the RNs might be able to work towards and going into a little bit less than actually pharmaceuticals, so.
Okay, terrific. Thank you. And over to Holly.
Hi there, I'm Holly Crow. I am the internationally educated nurse navigator with the association. And I guess one of my questions would be, if you were elected to the board, what would be one of your main goals in your role as a board member?
Okay, thanks. I'm going to randomly pick Tammy. What's your main goal for as a board member?
As a board member for AAN, I think I bring an outsider's perspective in regards to both rural and acute, and I see a lot of gaps between the rural and acute settings. And even if you bring into collaboration the PDD, persons with developmental disabilities, and say Alberta Health Services and Covenant, and there's such a gap in the care and the services and the knowledge. I really want to bring in a collaboration of that knowledge and those resources and those templates together. So kind of maybe there's a missing tool or a missing pyramid of information that makes it difficult for all areas like RNs, LPNs, physicians, patients to know exactly how to navigate the system and to work together to bring about the quality of care that we want to give our patients. We all have the desire to give the best quality care and quality services and stuff, but sometimes the resources are just kind of like are out there, but they're not easy to navigate.
Okay, thanks. Doran.
Okay, and I'm gonna have to pick two, but it's kind of one thing, if that's okay. And first off, I want to say, Kathy, what was it? Holly, who asked the initial question. Thank you for international nurses, because the recruitment lately has just been so nice because of some of those programs. Not sure what aspects of that you worked on it, but thank you so much, Holly. What I would want to bring is to bring together, first off, bringing back safety and security to nurses so that they're enjoying their jobs again. And then through that, bring back or highlight the sense of pride in being a nurse to everyone, both just by building up, that sense of community, bringing back some of that old school pride to nursing, and creating that really specific value proposition through the Alberta Association of Nurses by creating events to get people together into that community and build that pride back so that we're happy, healthy, safe, and proud of our profession.
Thank you. And Tara.
Great. It's definitely hard to pick one goal, but I think that my goal would be to look at retention. So how can we as a board advocate and work with our partners to increase nursing retention? So looking at things like getting new grads to stay after school, getting engagement from nurses that are already working, seeing why nurses are leaving the profession. That would be my biggest priority, because we already are experiencing a nursing shortage, which, as Doran said, yes, the EINs are helping, or the IENs, sorry, are helping, but it's not enough. It's not enough to sustain the number of nurses that are leaving the profession and not starting in the profession. So that would be my first goal, would be to look at how we could accomplish that or start the ball rolling.
Okay, thanks. And I'm just looking at the time. It's 1:45, so we do have time for two more, and we got two more hands up, so this is good. Peter, you were next, I think.
Excellent. First of all, a little caveat statement. I love this conversation. This is chicken soup for my nursing soul. So thank you so much for everybody who's contributing. I'm a registered psychiatric nurse. I'll leave it. I'll just kind of preface it with that. So my question is this: if elected as a board member, how would you recognize and challenge the inherent bias towards your own nursing designation in order to advocate equally and fairly for all designations while building community among the broader profession?
Thanks, Peter. Let's go to Doran first.
Yeah, and I mean, that's especially thinking about the RN LPN question. I mean, you're kind of taking me back, Peter. We used to work together. And my start as an RN, I was, it'd almost be the outsider kind of in mental health substance use, because it was typically RPNs there. But I think that there's the best way to do that is just to look at how much we can learn from each other. Or maybe I'm thinking too personal with it, but there was so much knowledge that I had to gain from RPNs just to be able to kind of hang with everyone that had been working there for 5 or 10 years, that I had to look up to other professions, and I think that the more that we can kind of build bridges and not differentiate as much, but understand scopes, I think we can bring that back together, not to highlight it again, but just as a community of nurses.
Thank you. Tammy, you're next.
I mean, I've never been one for division. I think we equally bring traits to our working profession equally, and we try to learn and provide the best care and to our patients as but I think a lot of it has to deal with our communication skills and our ability to be adaptable. I mean, everyone has different personality traits and different communication and that we bring to the table, and we need to be able to, I guess, we're always assessing our patients, we're assessing each other, and being able to keep in check our tone and affect with each other and our team dynamics, and I'm really one that believes in strength-based leadership. And so if there's certain areas that maybe I'm not strong in, that hopefully there's other people on the team that are strong in those areas that are able to build that team and collaboration. And you know, sometimes we need to be accountable to each other, you know, like keeping each other in check in regards to our emotions and our and how we're you know, doing an appropriate work-life balance, and making sure that, you know, like we're in the best top shape for our performance at work, and that our team is also able to collaborate with each other. And um, yeah, I think, you know, I really believe in, you know, like that we're equal and that we're fair and that we're inclusive to everyone. Yeah.
Thanks. And lastly, Tara.
Yeah, I think that that's a good question, Peter, about the inherent bias. So kind of looking at that systemic bias that exists in the healthcare system and how could we manage that. I think it's interesting that if you were to ask mostly any interdisciplinary colleague if one nurse was an LPN or an RN or an RPN, they wouldn't know. We're all nurses. So it's kind of something that nurses put on themselves. And it's an interesting dynamic. And it kind of goes back, I think, to that, like when nurses ate their young, for lack of a better term, and treating each other kind of poorly based on experience or designation. So I think it's making sure that we're building up and recognizing that we all have differences. For me personally, working in the emergency department, RPNs, I couldn't have done my job nearly as well without the support of somebody who is able to handle somebody in a psychiatric crisis. So building up and discussing who brings different strengths to the table, and promoting that we all have things that we bring, and that we all are here for the same cause. We're all here for patient care. We're all here to make sure that patients are safe and that we're safe while we're working. So I think that advocating for that perspective would help hopefully continue to eliminate the bias that exists.
Okay, thanks. Caroline, you're up.
Hi, everyone. I'm Caroline. I am currently sitting as one of the board of directors of the AAN. So I just want to thank you, first of all, for putting your names forward. I'm very enthused to see such a group of capable and passionate nurses wanting to help out. My question is, I'm sure you're aware, it has been a very interesting time in Alberta in terms of politics and healthcare, and the AAN has to both collaborate with government and advocate on behalf of our members. So recognizing that there have been times and likely will be more times when these two things are in opposition, I'm curious how you might balance those two and how you would help AAN navigate the relationship with our provincial government, whoever they may be.
Thanks. I'm going to go to Tara and tell you you have less than 1 minute.
Okay. I think that it's important to remember that we're nonpartisan and that we are advocating for the best interest of Albertans, and as well as nurses. So to focus on that and see what kind of common ground we have with the government that is in, and what agenda we are wanting to push through and how we can kind of meet in the middle. There's usually a ground to negotiate.
Terrific. Thank you. Tammy.
Definitely politics is a hot topic, and I think as AAN is that we have to be collaborate as one voice, come to decision and work on that together as one voice. We have to empower ourselves and as AAN and nurses to be that one voice to say, hey, you know what, this is our stand and this is where we're going, and in order to move forward, we have to be together as one team and put aside our differences and be able to move forward.
Thanks, and Doran, thank you.
Yeah, and whenever there's lots of change, there's always lots of opportunity as well. So doing things like trying to influence the policy while it's going, working with all these new organizations as they come up, there's a lot of different opportunity. I know we have a minute, but a quick example of that type of thinking is I started a couple thought leadership pieces to try to connect in with Primary Care Alberta just as they were getting started up, to help them de-silo with Recovery Alberta, and then had meetings with both their CEOs, which I saw as an opportunity that they probably thought of already, but I was just highlighting it so that they don't forget while we go forward.
Okay, thanks, Doran. You're going to be next. Margaret, last question.
Thanks, everybody. And again, good discussion and interaction. And I don't know how much you can answer my question, but one of the things that I've heard tonight is a lot of operations discussion and a lot of discussion about care provision. And so I want to be sure that everyone is clear that this is a strategic board. This is not an operations board. And so the role here is to help AN develop its strategy for going forward, which is then enacted largely by the operations team. So I'm just curious about how you understand the role of AAN versus an employer versus a union versus a college. So anybody want to take that, and do you think you can do it in a minute?
Okay, let's start with Tammy.
A lot of it has to deal with the leadership and I guess that the AN has different things that they have to develop leadership for Alberta Association Nursing's, like to cultivate it, such as like some of the training that's available, and having webinars available, and just being involved in our workplace, to be on councils that would improve workplace. So as we're part of AAN, then we're also part of our own personal workplace to enhance yeah, I'm to address those advocating for patients and advocating for workplace challenges, and trying to influence healthcare strategies and improvements.
Thanks, Tammy. Okay, Doran.
Yeah, and thanks, Margaret. I was thinking that while I was answering that these are very operational answers. I do know how a board works. I've done kind of governance refreshes before, but AAN itself represents kind of nurses and the profession, as opposed to CRNA, which protects the public from the profession, is a quick way to put it, as opposed to unions, which would represent employees versus their employer. Is kind of the quickest way that I would put it. But thanks for putting that out. It's just my day-to-day hat is very operational. So thanks.
It's hard to take that operations hat off, for sure. Okay, and Tara.
Not unmuted. Yeah, I think that the AAN is there to look at the future of nursing and healthcare and what it can do for Albertans. So the bigger picture, the broad scope, how can we advocate for system level change? And while we have been talking about a lot of operational priorities, I think that a lot of those operational priorities do need to be looked at from a governance level and put forward through advocacy to government, and looking at how we can have that kind of oversight.
Okay, thanks. I wanted Kathy to just outline the voting, but let's do one last round of any last thoughts before we wrap up. Tara, you're still up on my screen, so you're first.
No, but I have very much enjoyed this conversation. So thank you for letting me be a part of it and letting me be a candidate for the board. I appreciate it a lot.
Thanks. Okay, Doran.
Yeah, not too much to say, just really thankful for the opportunity, and really love kind of building and improving different organizations.
Thank you. And Tammy.
No, it's been great to become a part of this candidacy for the AAN. I enjoyed it, and I look to keep on reviewing the newsletters and the information that's coming out, and learning more about AAN and its contribution to the nursing and moving forward in regards to nursing and bringing us together.
Terrific. Thanks, everyone. Honestly, it has been just exciting to think of new ideas and new people to join the board. So really appreciate all three of you putting your names forward with such clear passion for nursing and for nurses. So it's fantastic. I wanted Kathy to just quickly remind us all, and we're a small group, but we're mighty. How are we going to vote? Over to Kathy.
Yeah, thanks, Barb. We're trying something a little bit different this year. If you were at the annual general meeting last year, which was part of the conference, and I hope you were, the people who attended the AGM were able to vote. But it's about 1% of our membership, and we appreciate that while the value of in-person AGMs, we also understand that like lots of people just can't attend a 2-hour meeting that starts at 8 in the morning. So what we wanted to do though was engage members as much as possible. So this year we're going to do an online vote. And so the vote will go out via email on Monday. And there will be a reminder and a link to tonight's presentation so people can rewatch and hear what you have to say. The vote will take place. And then for those who are attending the AGM in person, they will vote in person, but using the same platform. And the winners will be announced at the AGM. And if you're there, that's fantastic. You can, we'll be able to recognize you. Otherwise, I'm sure our President Peter will contact you as quickly as possible after the AGM, which is the morning of May 2nd.
Okay, and with that, it's 8 o'clock. I think maybe it's 8 o'clock. 1 minute. Wanted to make a plug to attend the AGM and importantly, the conference this year. The nursing conference looks so exciting. So thanks to the AAN staff and team for building up another fantastic conference. You can look on the website for registration and we'll see you there. Thanks for organizing, Kathy and Valerie, and again to the candidates. Your interest and willingness to serve on the board is much appreciated.